This is the mandibular central incisor. This is the right side, so universal number 25, Palmer 1, and international 41. From the facial side, the incisor-cervical crown dimension exceeds the mesiodistal. So that means that this length, the incisor-cervical, is longer than the mesiodistal. So the way I think about it is it's taller than it is wide. It's the smallest tooth in the mouth. The mesial and distal proximal incisal angles are symmetrical. So that is talking about these two angles here are right angles, and they are symmetrical to each other. From the facial view, you will also see that the incisal edge is a straight line and it's perpendicular to the axis, the root axis along the tooth. You may also see 3 well-developed mamelons. You can't see it in this model. Sometimes you'll see 2 developmental depressions as well, although not as much as in other teeth. The proximal contacts are located in the incisal 1/3. So the proximal contacts would be here and here, and they're located at the same level in the mesial and the distal. On the lingual side, you can see the cingulum, which is here, and it's slightly offset to the distal. So the cingulum is, so if this is the bisector line, the cingulum is slightly distal, which is on this side. The lingual surface is very smooth and has usually no pits or ridges present, and this is a characteristic that can be used to distinguish mandibular incisors from maxillary incisors. If you're looking from the proximal, again, the incisor-cervical length is greater than the facial lingual, so again, it's taller than it is wide. The incisal edge is located lingually to the center of the root, so the root axis is here about, and then the incisal edge is here, so it's slightly lingual to that bisector line. And the incisal edge also slopes lingually. So this is the lingual side, this is the facial side, and you can see that the slope is slightly lingual towards the tongue. The facial and lingual heights of contour are located in the cervical 1/3. So the height of contour is here and here. It's slightly higher on the facial side, and it is S-shaped on the lingual side. So you can see this S shape here on the lingual. The cervical line form is a lot higher on the mesial than it is the distal. So this is the mesial side, and this is the distal side, and there's also a root depression on the distal as well that's not on the mesial side. So the mesial side has a higher cervical line form than the distal side, and the distal also has that root depression. The root is wider facial lingually than it is mesiodistally. So from the incisal edge, again, it's taller than it is wide. So the facial lingual dimension is greater than the mesial distal. And this incisal edge is also straight. So if you have this bisector line here, the incisal edge is perpendicular to that bisector line. And the crown is very symmetrical.